Thank you, Treasurer. So 81 new cases today. This is the stubborn tail of the epidemic curve. It's an overall increase of 79, so still trending down in terms of the 7-day average, but it is stubborn. I guess on a positive note, this is out of 25,000 odd tests processed yesterday, so that represents about a 0.3% positivity, so 3 positive results in 1,000 people tested, which is pretty good. And it's terrific to see 25,000 people coming forward for testing. We would really like to see that on a daily basis. In relation to the 53 historical deaths, the reconciliation process with the Commonwealth does have some complexities. There are mandatory reporting requirements for deaths from aged care facilities to the Commonwealth, but of course the Public Health and Wellbeing Act in Victoria has mandatory reporting of the coronavirus cases here. So there does need to be a reconciliation of those reported deaths to make sure that they are coronavirus positive cases that are in our system. And of course we work very closely with the Commonwealth, the Victorian Aged Care Response Centre and those facilities to make sure that that reconciliation is as accurate as possible. And that we are using the same national definitions. So the Communicable Disease Network Australia national guidelines for coronavirus have the definition of a COVID death that is used by the Commonwealth, used by all states and territories in that regard. But there is a process that needs to be reconciled with those different reporting structures. In terms of active cases in Victoria, we're almost below 2,000 now. For aged care facilities, also decreasing significantly, and for healthcare workers now under 300 active cases, as I understand. There has been probably 20 or fewer healthcare worker new cases each day. That has come down significantly in recent days. It's still too much. More than half of those are aged care related, but it has trended down both with a decrease in overall community cases, but also with a lot of the work that's being done through the Healthcare Wellbeing Task Force that's looking at all of those things that can help to mitigate the risk in those health facility settings.
Brett, with those healthcare workers, have you got any data on if they're spreading into housemates, families, how much of the numbers we're seeing are tertiary from healthcare?
Very limited, I think. Obviously, the Hotels for Heroes program has been very broadly promoted and accessible to healthcare workers. And they are choosing to use that whenever appropriate. Otherwise, they are isolating at home or quarantining, furloughing at home as appropriate. And there's very limited additional transmission in those households. Probably more in the aged care workforce. Again, the same programs are available, but I think just larger numbers overall. And for some individuals, transmission within households has happened when they've had pre-symptomatic illness even, so not all easily preventable.
How much is that? How much of, I guess, that cohort aged care workers are spreading it? What sort of percentage do you know?
Oh, I'm not sure, Rich. I know that close contacts of confirmed cases is about a third of our daily total every day. But that's across the board. That's not just in aged care or healthcare. That's all of our close contacts of confirmed cases.
And what are mystery cases doing today? Have you got any data on that?
Don't know for today. They all get reconciled over the next couple of days, but it's still sitting around the 10 or 15% of our daily totals, and so we'll be very close to single figures, if not single figures, already today.
Is that enough? Is that low enough to start thinking about opening up?
Well, of course, we've started thinking about opening up.
But actually, you think about a plan, but to actually pull the trigger on that plan.
Well, I think we still have all of the week ahead, but the trend needs to continue down. We wouldn't be happy opening up at 80 cases a day and with 10 mystery cases. We would need to have an ongoing downward trajectory to be satisfied with that.
Professor Sutton, there's now been 100 historical deaths reported to us this week. It's a huge number. Why has there been a lag? Some of these deaths occurred back in July and August. Who's responsible for the lag, I suppose?
We live in a federation of states and territories. There are complex reporting and obligations under various bits of legislation and directives. So as I say, the death reporting to the Commonwealth is an obligation of those aged care facilities. No one's doing the wrong thing here. And the notifications of coronavirus to DHHS in Victoria is an obligation for medical practitioners and laboratories in Victoria, and so we have to reconcile those together. We've gone through an audit process to try and make that as robust as possible, and we want to get it right. The alternative is to have reporting that is too much like guesswork, or that might have some recalculation of already reported figures. So the figures that we're giving now are locked in. They are the ones that have been properly reconciled and are accurate, but it does take time to get to that point.
Why does it
I've
take?
been told that the aged care facilities reported these deaths back in July and August, that families were notified and that normal death certification processes occurred at that time, but that DHHS was overwhelmed and didn't account for the deaths in their public health event surveillance system at that time. I've also been told that federal authorities alerted Victoria to these issues back on the 8th of August, but it's taken DHHS this long to go through that data and reconcile it. Do you dispute that that's what's happened?
I do. That's completely inaccurate. We have worked with the Commonwealth consistently using the public health event surveillance system as our foundational piece, because they're the notifiable disease records, and to take those notified deaths and to reconcile them appropriately before we come to an agreed figure with the Commonwealth. That's been the process all the way through.
Professor, you said you're working towards having the same national definition.
That's already in place. So the national definition in the Communicable Disease Network Australia definition is a probable or confirmed case of coronavirus who's died, where there isn't an apparent other cause such as trauma, or where the coroner finds that there's another cause of death.
Professor Sutton, just back on the deaths, can you confirm when the federal government gives you the deaths and then how quickly you report it?
No, I can't. There's a continuing process of needing to reconcile each and every one of those deaths against the known coronavirus cases. So I can't tell you exactly when the Commonwealth has received each and every one of those from aged care facilities, but the transmission of data is continuous between the Commonwealth and DHHS.
The
For
confusion
example,
is
with the 59 today, at what point would you have received or worked out that there were, sorry, it's 50 today, isn't it?
Yes. 53.
So it's 59 total today. The Premier mentioned 9 more recent deaths. That doesn't add up.
So 6 in the last 24 hours.
Okay, because he detailed 9 that he went through the ages for.
Yeah, 53 from before yesterday.
Yeah, but when you listed, you said there were 9 more recent ones, and
so that doesn't add up.
it doesn't add up.
I'm more than happy to.
Sure.
There are 50 deaths.
45,000 or so tests yesterday, but in regional Victoria report says just a trickle at some testing sites. Are you satisfied with the level of testing across the board in regional Victoria?
Pretty much. The level of testing across regional Victoria is good, given the 25% of the state population who are based regionally. We will always look at those individual towns and local government areas in terms of the testing rates. And we would always encourage everyone to come forward if they're symptomatic, but almost all of those local government areas are meeting the WHO threshold for numbers of tests that you'd like to see for every confirmed case. But we also don't want to miss any place that hasn't had a confirmed case, that may not have any active cases at the moment, by encouraging everyone to come forward. So there might be some places where there haven't been active cases for some time. I don't want anyone to be complacent thinking that they might not not have the virus there, because obviously there's still movement across regional Victoria. There are still people who get discharged from hospital or transferred from hospital in Metro Melbourne, and people who have to move to regional Victoria for essential reasons. So people need to be mindful of the fact that just because they haven't had a notified case in their local government area, that there won't be one there. People should always come forward for testing.
On Monday, when there were 33 historical deaths, you said something along the lines of you didn't expect this to happen again.
No, I didn't expect that there would be a lot, but clearly there's still been a significant number to reconcile. There might be a small number ongoing, but the processes we've worked through, including a regular daily feed from the Registry of Births, Deaths and Marriages, should help us to reconcile any ongoing cases in a timely way. But we can't rule out the possibility that they won't all come in on the day or in the 24 hours after they've occurred.
And just to clarify on the timing, did you receive the information about all 53 of those deaths yesterday, and that's why they're being reported today, or had you received some of that information prior to yesterday?
Well, some of it's been prior, but the whole number has been worked through to be reconciled as fully as possible, so that there isn't going to be a further change in that number, so that everyone is satisfied that we're speaking to the same figures.
Sorry, Professor Sutton, can you just explain that a bit more? You received those numbers prior to yesterday?
Well, some of them will have
So why
been
weren't they
known
reported yesterday?
because the process of going through and reconciling with our known coronavirus cases, checking with the Commonwealth and the Registry of Births, Deaths and Marriages is a process that we work through to make sure that we land it right, so that we're not giving a different number tomorrow.
So are there any more deaths that you know about that aren't being reported today?
No.
There's no planning to
Suggested a figure of, sorry, so it's just a figure of 40 to 50 cases a day by the end of the week. No implied criticism in my question, but based on the figures that we've seen this week and the trend, do you think we'll get there, or do those figures need to be revised up come for Sunday?
Whenever I've given a figure, it's always been with a sense that that's where the modelling suggests that we might be. I've avoided trying to pin down a number a week from now, 2 weeks from now, because of the great uncertainty around the tail of it. We might get to 40 or 50 by the end of the week. I think at the moment it's not tracking to head for 40 or 50. It might be higher, but I can't say. The modelling again suggests that it should be decreasing day by 5 or 10 each day on average. And so we could get there, but it's really hard to say at this point in the epidemic curve.
Are you seeing these cases in particular geographical areas? Is it sort of going back down the pyramid, if you like, to where we were in the 10 postcode lockdowns?
Yeah, in lots of ways. As it's contracted back to a lot of those areas where it was most prevalent at the beginning. So in the north and west of Melbourne in particular, Hume, Brimbank and Wyndham local government areas. But there's also been a bit more of a move out to the western suburbs, and as you know, the southeastern suburbs have had a bit more activity in recent days. So it is contracting back to where it all began, but it's not just a reversal of time in terms of how it's going.
Premier, can I ask you, John Setka said that we have written to you outlining the construction industry's steps it's taken to...
Hi, Brett.
Hi, Noel.
Do you know anything about the child who's developed the COVID-related inflammatory disease that we've seen presenting around the world elsewhere?
I do. As you'd know, I wouldn't speak to specific details that might identify anyone with a notifiable disease, but I'm aware of the case. PIMSTS, it's a mouthful, is a significant associated illness with coronavirus. It's an inflammatory illness. It's been likened to a disease called Kawasaki disease, which affects a number of organs, including the heart, has a big inflammatory component and can occur after a coronavirus infection. It is rare, but it is a serious illness, and children are particularly vulnerable to it. It's more common in boys than girls. It tends to happen in somewhat older children, so not infants, but I think the average age is 9 from international experience. But it is rare. But obviously when you've got thousands of cases of coronavirus anywhere in the world, then you're going to get the potential for one or two of these cases to occur. They are reported through the Paediatric Adverse Events Disease Surveillance System nationally, and so the PED system will have reported them to national bodies.
Okay, just on testing. We've heard a lot about the public effort, the 25,000 tests, and that's people who show up and people who present. Can you talk to us about what's going on in terms of targeted testing at work sites and areas where we know are risky, the healthcare workers, for example?
Yeah, so certainly any site that's got an outbreak, we're testing very broadly. We are going beyond what would even be a definition of a close contact, someone who's had 15 minutes of face-to-face contact or spent 2 hours in the same room. We are testing very broadly in a facility in the unit where those workers are. So that's occurring in aged care already. That's occurring in some healthcare clusters or outbreaks, and it's occurring in meatworks, for example. So there are a number of places where a single case will set off a cascade of testing that's very broad to try and find any and all cases that might be associated with it. But other than that, for community testing, we're certainly asking everyone to step forward for testing if they're symptomatic. But we're also looking at where there's a mismatch between where we know that transmission is relatively high and testing is not so high. So we're looking at those local government areas or postcodes, and we're trying to engage as much as possible. We're making sure that they're promoted. And part of the reporting on exposure sites where we know that some people have been when infectious, that's been up on our website in the last week or so. That's also a prompt. If there's an infectious person who's gone to particular settings, we think that's also a prompt for testing in those postcodes.
Brett, the effective reproduction number at the moment, is that still falling, do you think, or is it stalled?
I think it's probably still in the 0.8 zone, so it's still driving transmission down, but it's pretty tricky to get much lower than that. I don't know what it will be, but when you get down to very low numbers, it becomes less and less meaningful. We just need to follow the numbers day to day. We do know from the mobility data that it's still looking good. In terms of the amount of time people are spending at home, the amount of movement outside of the home, the traffic movement and public transport movement are all very good. Obviously, there are fluctuations on weekends and days of better weather, but overall, that's still a positive indicator that people's interaction has been sufficiently limited to help drive transmission down.
Professor Haber, what do you think of the Burnet Institute's proposal for a decentralised model of contact tracing? Does that have merit?
Yeah, look, I think we've explored decentralised contact tracing in as much as having the regional hubs now. So contact tracing had always been completely centralised in Victoria. We've seen very positive outcomes from our regional hubs because people know their local communities. The medical connections that are made there are very useful for those contact tracers in those regional hubs as well. And so I think it's worth exploring. I'm very happy to look into it for Metro Melbourne as well. I don't think now is the time, with all of the complexities that we're going through, to set up new systems of administration and IT support. But it's certainly worth the conversation, and it's worth understanding how it might be done conceptually going forward.
With contact tracing, Brett, how would you feel about adopting reportable benchmarks? So, for example, 95% of cases contacted within 48 hours, and then that can be reported against going forward.
Those benchmarks are there. They're in the national dashboard, and they are reported publicly, and we're reporting to them on a daily basis to the Commonwealth. So they are KPIs for contact tracing already.
How are we going right now?
We're doing very well right now. Clearly, we've got more cases than any other jurisdiction to follow up, and so we will have a few cases that are not contactable in 24 hours in terms of the full interview, but it's above 90% for that full interview. It's at 100% for cases being contacted within 24 hours. It's at 100% for close contacts being contacted. So that's a terrific performance overall.
A couple of weeks ago, you said that between a third and a quarter of aged care residents that get COVID are dying from it. In light of the historical numbers that we're getting now, has that percentage changed?
No, I think that's still the mortality rate really in aged care. It speaks to the extreme vulnerability of aged care residents that a quarter to a third of them will die if they have this virus, you know, I think it's a challenge to those people who say, I don't know what people mean when they say learn to live with this virus. Of course we'll learn to live with this virus. We're all trying to learn to live with this virus. But if people mean let it run, let young people who are less at risk of severe illness go out and get infected, they are not thinking that these people in aged care are our parents and our grandparents, are our aunts and uncles, are our great-grandparents, and are extremely vulnerable to dying from this virus. There's also been social media chatter about whether you die with this virus or from this virus. Well, I can tell you that a third to a quarter of people in aged care do not normally die from any infection. So coronavirus is extremely serious for those individuals. In a flu season, we can see 1 or 2 deaths in an outbreak in an aged care facility, but to see 20, 30, 35 deaths in an aged care facility, that is unprecedented, and it is entirely because coronavirus has a 15% mortality rate for people above 85 years of age. It's even higher the older that you get. So it's a very significant illness.
Do you have an up-to-date number on the number of people, including the 50 today, the number of people who died in aged care?
I may. No, not the. 505 is the total number in aged care.
And the rise in deaths, is this a result of when Victoria was at its peak, when we were seeing about 700 cases a day?
It is. It has a 2-week lag, more or less. So, you know, the very peak of the outbreak isn't when you see the peak of deaths. The peak of deaths comes 2 to 3 weeks later as people develop the most severe complications in that regard. But the fact that we're now on a daily basis, new deaths reported in the previous 24 hours is below 10. I think it will probably remain below 10 and slowly continue to trend down, which is very good.
And I've been contacted by a family member of someone who was in hospital for something non-COVID related. They contracted COVID in hospital and sadly died. How many situations are you aware of where people have contracted COVID in hospital as patients who weren't there to be treated?
Oh, that wouldn't be reported separately. I think the healthcare worker wellbeing task force might be looking into, you know, where the index cases are for some healthcare workers getting infected. They won't necessarily have all the statistics on whether particular patients have contracted it within a hospital outbreak, but we do, for each and every case, try and determine whether that's been contracted from a known close contact or unknown. So it's probably data that we can look into. I think they're reasonably uncommon events, but of course there's been transmission that's occurring in healthcare settings, and so that will have tragically occurred in some cases.
And are you aware of other deaths that have occurred as a result of someone contracting COVID in hospital? I think there was one at Brunswick Private Hospital.
Yeah, I'm aware of others, but I don't know the exact numbers, Rachel.
If Melbourne's stage 4 lockdown does get extended by another 2 weeks, Melbourne would have been in lockdown for longer than Wuhan in China and longer than Italy. Is it just that we can't go back now? We've been in lockdown so long, so much damage is done that we can't change the way we handle coronavirus? We are only in lockdown in stage 4 for the purpose of driving down these numbers. And again, it's been said before, but not for a moment longer than required, but also not to be lifted with a significant probability of it all coming back. What you call lockdown internationally is probably up for debate, but people still have their haircuts outside in San Francisco. You can only dine outside in New York. There have been restrictions across the world that have carried on from February right through to now. So there are constraints in the way that people live and the way that businesses are set up that have been continuous for months and months across the world. We are going through the harshest period of our lockdown right now, but we are doing it with the absolute intent to get to a point where we can confidently lift those restrictions and keep those numbers down to an absolutely manageable level.
So
Do we have a plan B if we can't get to those numbers, if we can't get to less than 5 a day?
we will review those numbers every day. I'm confident that it's all heading in the right direction and that we are doing the right things to get them to those levels where we can absolutely make considerations for opening up. I'm very confident that that will be the case.
Thank you.
Thank you.
Thanks very much.